In this video, I will go over one of our pharmacy measures, the antidepressant medication management and the effective acute phase treatment. The population of patients that fall within the category of this pharmacy measure are patients 18 years of age and older who were treated with antidepressant medication, had a diagnosis of major depression, and who remained on an antidepressant medication treatment. The numerator for this category are patients 18 years of age and older as of April 30th of the measurement year and May 1st of the year prior to the measurement year, who were treated at least 84 days with antidepressant medication, beginning on the IPSD through 140 days after the IPSD, who had diagnosis of major depression and who remained on an antidepressant medication treatment. The required exclusions for this pharmacy measure are 1, hospice care, 2, members who did not have an encounter with a diagnosis of major depression during the 121-day period from 60 days prior to the IPSD through the IPSD and the 60 days after the IPSD. And lastly, members who were dispensed a prescription for an antidepressant medication 105 days prior to the IPSD. The documentations that are required for this pharmacy measure is first, a note in the medical record confirming of any major depression diagnosis. 2, documentation in the medical records of the earliest prescription dispensing dates for an antidepressant medication between April 30th of the measurement year and May 1st of the year prior. Some of the common insufficiencies that we have seen for this pharmacy measure are failing to document any diagnosis of major depression, and 2, failing to document index prescription start date for antidepressant. Please review the following chart on the slide for more detail on different codes that are associated with this particular pharmacy measure and the description that is linked to these codes. Some best practices to address this pharmacy measure is to educate your patients and caregivers on the importance of continuing medication and scheduling follow-up visits, even if they feel better. Second, stress that they should not stop medication abruptly or without consulting their medical provider for assistance. Third, effective care may require collaboration between primary care provider, psychiatrist, and psychologist. And lastly, our care coordination team can provide patients with individualized support. In order to refer a patient, please contact us at 602-406-7226 or 855-218-3451, or you may reach us at the following email and we can assist you in creating an individualized plan for your patient. Make sure you work with your CPC to educate your team on this particular measure. Build a workflow to chart prep and identify open gaps before a patient comes in for an appointment. And please familiarize yourself with the Arizona Care Network resources that are available to you. Your number one resource is your CPC that can provide education and support. The quality measure tip sheets that are available on our website, the Arizona Care Network provider portal, as well as Arizona Care Coordination Team that is available to you and your patients. And lastly, you can visit the Arizona Care Network website for updated 2024 tip sheets. The following picture on this slide is a sample of what the tip sheet looks like for this particular measure, which can be found on our website.